Welcome back. We're here with Bob, who is a chiropractor in Perrysburg, Ohio. Bob, how are you?
I'm doing great. How are you?
Fantastic. I'm very excited to dive into this topic. You're the first chiropractor that I've interviewed, so I appreciate you coming on.
My pleasure. Look forward to it.
Yes. So when people say chiropractors are not real doctors,
Oh, don't get me started on that one.
what do you say to that?
Well, I went to the most medical of the chiropractic colleges, National University of Health Sciences. Some of my colleagues would actually consider me a metapractor as a bad thing because of the medical training. And I did 4 weeks of an internal medicine rotation at UPenn in Philadelphia as part of my training. And I also used to work, I had a license as a clinical counselor and used to work at the medical college in Toledo in the Department of Psychiatry. So I was well versed in what it took to be a medical doctor.
Yeah.
The program that we went through was very close, and actually some of the faculty who used to teach anatomy and physiology that were at MCO, at that time it was MCO, happened to be faculty at the college I went to. But basically a chiropractic physician in the state of Ohio has to have a bachelor's before they're allowed to matriculate into Chiro College and to get a license. Chiro College is 10 straight semesters. You do your first half in basic sciences just like medical doctors do, and then there's a board exam after that, national board exam. So you have to do that just like medical doctors do. Then you have your clinical sciences. The major difference there is most of our clinical science stuff is more in the classroom and not as much out in the hospital following doctors around. We have clinic time, but most of that's musculoskeletal stuff and not the cardiology and all the other things. So that would be like the major difference. But we also have to take a board exam at the end of that, just like a medical doctor does. And then we do our internship, and then we're done. So then we don't have to do the residency. But as far as school goes, it's virtually identical. In fact, when I was at the school in Chicago, some of the Chicago medical students used to come to our library and study with us because they thought we knew as much or more, and it was kind of fascinating when we did that. So it's, there are subtle differences, but they're very, very similar.
Yeah.
I mean, we do human cadaver anatomy lab just like they do in medical school and all of that stuff. So we in our school had to learn pharmacy and pharmaceutical stuff because in Ohio, it's scope and practice for a chiropractic physician to do herbal medicines. So you can do the holistic natural health care, which is why I did the 4-week internal med rotation. A chiropractor in the state of Ohio, besides adjusting spines and focusing on the common things people think we do, the musculoskeletal and the adjustments, we, as part of our scope and practice, are allowed to draw blood, so we can do needle sticks. We can diagnose any condition that any other doctor can diagnose. We're not allowed to treat an infectious disease. And of course we can't write prescription medications, but I can diagnose it. And then if you had an infectious disease, I have to refer you to somebody who's licensed to treat that. But I can give you nutritional support to boost your immune system and things of that nature. So I mean, we can do male and female sensitive exams and all of those things. We were trained in. We used an identical system at our school to what they used at MCO for that. And it's like, most of us don't do those things, but it is scope and practice for us. So.
Yeah, that's very fascinating. And, I think most people, they don't,
Nobody knows.
realize a lot of those things. And this is a question from Dahlia.
Okay.
Can you explain the benefits of chiropractic care when mixed with massage?
Sure. That's kind of a hand-in-hand thing. When Dolly and I, when we were talking about that here, it doesn't, some people prefer doing a massage first and then getting adjusted, or we adjust and then do the massage. It doesn't make much difference. They're both beneficial. Depends specifically on the client. So the massage will help with the muscle tissue and to move fluids around. So you'll help with, waste product removal and also getting nutrition to the tissues. When I do an adjustment, if I do an adjustment first, I'm lining up the spinal segments. But that controls the nervous part of what's happening. So you're combining the nervous system with the musculoskeletal system. One of the reasons that adjustments, well, in the dynamics, the science behind how an adjustment actually works, when we move a segment, there's a quick motion there. Are you familiar with the deep tendon reflex?
No.
So if a doctor takes a reflex hammer and bangs you on your knee and your knee kicks out, neurologically, you're sending a signal up to the brain. It gets there. When the body goes, oh, there's not a danger, there's not a problem there, then it sends a shutoff signal down there. Well, when we do that in the spine and we do an adjustment, there's a quick stretch to the tendons associated with that. So there's a shutoff signal that comes back down, and it literally helps relax and block some pain, which then means, depending on the condition, the massage might be the perfect thing to do afterwards, or the other way around. She needs to relax the muscles enough so that I can actually get a better motion on the segments I'm trying to put back in place.
Interesting.
So they work really well together.
Yeah, and early chiropractic methods can be traced back to the early 2700 BC.
Yeah.
And why do you think this practice that was traced back to the early 2700 BC is dismissed by modern medicine?
Well, I could give the classic contemporary answer of pharmacy and the money and the control that goes into that. There are historical references to all kinds of manual manipulations of bones and joints. In the United States, it didn't start till like 1906.
I think it was 1895 I saw.
Well,
like the early.
Dr. blocking his name, Palmer, was the originator. And then his son took over and ran the school. In the first class of Dr. Palmer was, Dr. Howard, who was a medical doctor, who then went to Chicago and started the school I went to. So it's an offshoot of that original philosophy. If you think about Chinese medicine and their studying of the energy flow through the body and why they use the needles, well, it was postulated and developed into the nervous system does control everything, brain, spinal column. So if a segment is somehow out of place and we put it back, it should work better because there's nothing interfering with it. And there is actually contemporary science now that shows that if you have some kind of an impingement on a nerve, so the end organ tissue will atrophy or not function as well and begin to deteriorate. So if we keep everything lined up nice, the communication within the body will be better, and then the whole body will respond better and function better. If you go classic theory of chiropractic, then that's also how you would treat anything. So then the body can then respond, have an immune response, do whatever, and it's not interfered with the nervous system being interfered with.
Yeah.
Well, it goes a little further than that. We get into the God stuff. So the innate is the outside of the body part that controls things from classic theory. Contemporary stuff, our school is, if it isn't science, we're not teaching it to you, but they still teach that heavily in school. So it's part of natural healing. Yeah. And so it's just development of that from way back when. Modern medicine, when they could treat infectious diseases, branched off into what they were doing. At one time, our school used to be associated with the Chicago Medical School. Unfortunately, some of the students during surgery would ask people if they've tried chiropractic first as they were going down under anesthesia, so they got rode out of town to the suburbs to do that. Now they're connecting again. Yeah. They just started to do that when I was doing my internship. We started having medical docs come in. And because there is a relationship there, and some of my referral sources are medical doctors because they know they can avoid surgery and some other things if they send the patients here. I hope that answered your question.
Yeah. I mean, there was, when I was doing my deep research on it, realizing that it was a thing all the way back then was very shocking.
I don't know if you've seen some of the videos that people have sent me of, like, somewhere in Asia, people hitting people with hammers.
Yeah.
And they're like, no, we're not doing that. But they do it. You know, it's still an offshoot of how they used to do that in ancient times.
Yeah.
And it's like, okay.
Yeah.
But like, ooh.
And how can going to a chiropractor cure ailments in the body?
Well, when we line up the segments, the nervous system will then respond better. So then the tissues at the end organs of the nerve. So you've got your central nervous system. So you get the brain and the spinal cord. And then there's a set of wires or nerves, peripheral nerves that come off that. There's also an autonomic nervous system, which is a part of the body where you don't have to consciously think about it. Keeps your heart beating, helps with your immune function, all of those kinds of things. If you have segments that are even slightly out of place, there's an interference with the signal. So there's a joint that comes off the spinal column called the facet joint. And if that's off, there's a little nerve that comes back and goes to their nerve root. That can be causing a signal that gives you a pain response.
Okay.
Well, with the pain response, your brain doesn't know the difference if a nerve root's injured or if it's just that. And that can interfere with how the rest of the body and the other systems are functioning, because the pain will take priority in your brain trying to process what's happening. And so then other signals don't get where they need to go. When we line that up and there's relief there, then the system can function more efficiently like it needs to function without interference. And then you can heal or do whatever. Did that answer your
Yes.
question? Yeah, okay.
Yes, it did. And, you also use the carnivore diet on top of,
Yeah.
like what you do to heal your patients. How have you like gone about incorporating the carnivore diet to help, cure your clients?
Well, when I'm talking to my clients, I want to talk about the whole picture.
Yeah.
Lifestyle
Yes.
included, as you're aware.
Yeah.
So in my research, I've come up with the most contemporary stuff is showing the simplest thing from diet is the ketogenics and carnivore are the most anti-inflammatory. Autoimmune disorders go away when people follow these protocols. And there's, each patient isn't the same. So I like a particular Dr. Kim Berry's work, so it allows flexibility to, let's start here, then do this, then do that. If we need to, then we go all the way full carnivore, like an elimination diet, and add stuff back in as the patient likes, depending on their condition and what happens. But to help somebody, when I got them on the table, and it's like, well, I can do this, but, if you keep eating the carbs, if you keep doing this, if you keep doing that, I can adjust you and you feel better, but you're not going to get better.
Yeah.
And so if you want to get better, you need to look at those things. And the same with the whole mind-body thing. So it's considered, since you asked that question, there's like 3 basic stressors, right? We have mental stress, we have chemical stress, and physical stress. So physical stress would be an injury to the body. Chemical stress would be when your biochemistry is off. It can be from, something you do to yourself, like foods with poisons in them.
Yeah.
Drinking, recreational drugs, too much adrenaline from the mental stress, those kinds of things. And then as you think about things mentally, you also influence that biochemistry. Well, if we can treat 2 of the 3 efficiently, the third will come along.
Yes.
Okay, and we'll achieve a balance. So structurally, if I'm fixing you physically, okay, then if we fix the diet, we're fixing the chemical. We got the whole thing going.
Yeah.
And so then not only do they feel better, but then they don't need the meds, they don't need whatever else they're taking for all the other things in their life, and they see these amazing changes. Great. Now, in general, we want you to come like for a maintenance, even if you're not having a problem. Your nervous system controls everything. Why wouldn't you want your spine checked and to make sure everything's aligned and working like it needs to optimize your health? And typically for that, most patients, if they have had a problem, we get them to they come back once a month. Usually if they go a little longer, if they haven't fixed their other habits, they start to have some pain, it's time to come back.
Yeah.
So, and in general, if you're just looking for wellness, once a month usually works fine for most patients. Is it?
Yeah, and I think with you dueling the diet plus with the chiropractic care is very interesting, because I feel like most people don't take that approach. How do you find the line between it being a chiropractor problem versus being a diet problem? Like, where does that line kind of, end for you?
For me, doesn't it? It's like I may end up where I just have the patient and that's what we're consulting on. And we might add some supplements or herbal medicines to help them. I'll still adjust them because I think it's a healthy thing to do in combination. Make sure everything's aligned, etc. But it's a huge component. So I always look at that when I'm working with somebody.
Yeah.
I do have a couple people who we're predominantly working on their diet issues, and they come and get adjusted, but it's mainly, okay, I tried this, I'm doing that, and it's like, okay, what about this? And that's what we do.
Yeah.
So, and a lot of people aren't expecting that when they come in, so it's a little bit of a
not.
surprise. And I'll also talk the mental health side. As you know, I like Dr. Dispenza's work for mind, body. So, and because I was a clinical counselor for 30 years, and when I worked at the medical college, I was a behavior medicine specialist. So we did biofeedback. So I was in the mind body way back then. And it's like it all goes together. You can't separate the mind and the body. They're attached and connected.
Yeah. Yes, they are.
So, but that's the difference in part between what we do or some other alternative practitioners do versus medical doctor. In allopathic medicine, they're focused on your disease. We diagnose this and we treat that. Well, they don't even treat it now. They just give you symptom resolution with pills. There's a few moves from a few doctors to get at that. Well, we always think we're trying to get at the underlying disease process. That's part of what chiropractic is about. If we fix this, the body heals itself, underlying and naturally, or to the best of its ability. And then you may still need some meds or something. But if we do this, we can minimize, between the diet and the adjusting, massage, and get those things all tied in together. Patients do really well.
Yeah. I have 2 more questions.
No problem.
If you could have dinner with 2 people,
Oh, God.
one person from the past and one person from the present, who would it be and why?
Well, the present, I love Dr. Dispenza.
Okay.
He's also a chiropractor.
Oh, really? I didn't know that.
No, he injured his back he was a triathlete and he got injured in that and he healed himself. He had spinal injury.
Wow.
And refused surgery and healed himself. And then he promised, I think the way he put it was, if he promised God that if he healed himself, he would devote his life to this work and how to teach other people to do that. And he studies everybody he sees. So when he's doing a seminar and people are getting better, they have data that's like on over 10,000 people now. Wow. So there's hard science that shows how people can heal using the power of the mind and ways to teach them how anybody can do it. Yeah. So that I would love to dig into that brain at dinner somewhere, and because we have the chiropractic background, we can tie all that together and do whatever. If I had to go back in history, I think I would go to D.D. Palmer.
Okay.
The originator of the first chiropractic school in the country, and his whole philosophies and how he did things. The more I've looked at what I know about him, it's like, oh, he gets it. Yeah. Chiropractic had to be separate when they came up because they didn't want to join the medical community. They wanted their separate thing. So it had to be separate. Otherwise, you were getting charged with doing medicine without a license. So there was a whole interesting philosophy there. So some schools went and just focused more on the adjustment, like you're a good technician. I don't mean that to insult anybody. They're still good doctors. They're still trained with all this stuff, but the emphasis is a little more on the technical skill of the practice. Whereas like my school is a little bit more knowing everything, and you happen to be a chiropractor too. Yeah. That was their philosophy. You happen to be a physician. You're a physician who happens to be a chiropractor. That's come in handy for some of my own health issues, I have to say. But, So D.D. Palmer, as the originator, loved to pick his brain about that. Of course, back then, bloodletting was how they treated infectious diseases. So there had to be something better. And, you go to a doctor, you get a leech or something. While leeches still have their place, actually.
Interesting.
bloodletting for polycythemia vera. There are some places in modern medicine that use leeches instead of just drawing blood from the patient. When they make too many red blood cells, so you just have to give blood to get rid of it.
Yeah.
But they'll use leeches sometimes. It's
Interesting.
Okay, and that was one of the original ways they did that.
Wow.
Yeah.
That's fascinating. I have one more question for you.
No problem.
Why did you decide to partner with us and offer the discounts?
It's a way to reach out and help more people. I liked what you had to offer. The more I thought about it and talked to Dahlia some about it, it was like, well, I can do that. I mean, there were restrictions legally. I thought that I couldn't do it. And when I looked into it, it was like, oh, here's a way I can do that. And I didn't know I was going to be doing something like this, but I like it. I love doing these kinds of things and, helping the public, even if I'm not adjusting people, that I can talk to them and do talks and, do public speaking if a community group wants me to, all of those things. But your connections that I saw intrigued me, and I thought, oh, this could be very helpful. And now I'm like, okay, I want to know more about what I can do that's similar to some of the things you're doing, just to be out there and help people even if they're not in my office, like, okay, do the podcast. Yep. Or, how do I share stuff on some of the other media? But that's,
Yeah, well, thank you.
So far, so good,
Yeah, I mean, we appreciate it. That's all the questions I have for you. How can people find you, and what is one thing you want to leave people with?
Well, they can find us at, my official name of my company is Robert C. Spain Jr., DC, LLC. We're in Perrysburg. It's 1011 Sandusky Drive, Suite F in Perrysburg. Sandusky Street is Fremont Pike or 20 for those who aren't familiar with the area. We're in the building next to the Huntington Bank. That's a landmark for people. Or just down the street from the motorcycle shop for the... phone number is 419-874-7470. Call me anytime. I'll call you back if I'm not with somebody, because I'm a one-man operation. And we'll make an appointment or discuss the cases. I'll say, okay, maybe I'm not the right guy for you after discussion, and maybe you need to go wherever the proper referral might be. I've done that several times. So that's how they can find me. I forgot the other half of the question.
What do you want to leave people with?
Oh, just, chiropractors are decent these days. We're not quacks. We're not, we're trained in medicine just like everybody else is. We understand and recognize a lot of things, but we're also trained in the use of natural health care stuff in addition, like we talked about. Yeah. So it's like, it's not, I love what I do. So it's like, if you're going to come see me, I love what I'm doing. Yeah. But I have a passion for both adjusting people and the diet side of helping people lifestyle-wise fix everything. So it's like, be happy to help if somebody needs me.
Awesome. Well, Bob, thanks for coming on. I appreciate it.
It was my pleasure. Thank you very much for having me.